The majority of hospitals outsource their food services. This, however, does not relieve patients and employees of their responsibility to supply safe meals. Hospital administrators must apply acceptable standards to food safety management systems while also adhering to legislative restrictions. It should be included in the selection procedure as well as a constant review of the service provider. Topics for discussion are definition, role, challenges, and prevention. What is food safety? The concept of food safety refers to the way in which food is handled, prepared, and stored, so as to reduce the risk of foodborne illnesses and product contamination. The term food safety refers to practices that ensure the food provided is safe for consumption. Why is it important? Infectious diseases spread readily within the hospital because of its nature. Patients, visitors, caregivers, and staff should all follow infection control protocols to prevent the spread of harmful bacteria. Consuming nutritious foods is one of the most important parts of the healing process. Healthy food facilities are also crucial for providing nutritious meals to employees who work under stressful conditions in order to maximize productivity. What are the challenges? Foodborne illness and outbreaks caused by inadequate food safety can result in severe diseases, expensive medical care, infection transmitted to visitors and other patients, preventable deaths, and employee disruption. Food safety is universally important, but vulnerable individuals are more prone to have low-level pathogens contaminate their food and hence become ill. This places a greater responsibility on medical institutions to do everything possible to ensure that safe food is always prepared and served. The majority of hospitals outsource their food services. This, however, does not relieve patients and employees of their responsibility to supply safe meals. Hospital administrators must apply acceptable standards to food safety management systems while also adhering to legislative restrictions. It should be included in the selection procedure as well as a constant review of the service provider. How to prevent? Hospitals often do an outstanding job of avoiding food poisoning by employing 3 critical stages. Implement a comprehensive food safety program, monitoring and recording on a daily basis, implementing food safety training and certification. Comprehensive food safety program. Food cooked in hospital kitchens is supplied by third-party vendors. To prevent food contamination, hospitals should require these food providers to adhere to strict hygiene standards as well as comprehensive food safety policies and best practices. This, unfortunately, is not the case. The source of most hospital food poisoning infections may be traced back to procurement. When food or raw materials are supplied, they might get polluted. All entering foods should thus be evaluated for physical, chemical, biological, and allergic concerns. Failure to follow this critical control can have dire consequences. In the worst-case scenario, hospitals must contemplate extensive criticism and testing. Daily monitoring and recording. In the hospital, keeping cold food is a matter of life and death since viruses, bacteria, and other pathogens normally live and reproduce within a certain temperature range. Temperature monitoring is a frequent and necessary procedure in hospitals. It involves the following measurements: refrigerator temperature, final cooking temperature, food temperature before and after serving, dishwasher temperature. Using a daily checklist, accurate records should be preserved and stored. For example, temperature log, report on patient meals accuracy, quality audit by an external company. Food safety training and certification. Most hospitals require catering employees to undergo nationally recognized food safety training courses, and all hospitals must have at least one food safety officer on site at all times. As a result, all individuals involved in the delivery, provision, or procurement of food within hospitals must be taught on safe food handling techniques, various forms of food contamination, personal hygiene, foodborne illnesses, and HACCP principles. Furthermore, management personnel should acquire basic training on safe food handling practices. The food safety training workshop should be mandatory for all hospital staff before operating in the kitchen or serving patients. I hope the information provided reached you well. Thank you for listening and have a nice day.